Welcome, everyone. Thank you for joining us. We'll get started in just a moment. Welcome and good afternoon to all of you. Thank you so much for joining us for this exciting and important panel discussion today around shifting power through racial equity-centered evaluation. My name is Lacey Stevens. I'm a senior program manager with the National Farm to School Network, and I'm so glad to welcome you and to welcome all our moderators and panelists for this conversation. First, just a few housekeeping reminders. We welcome and encourage you to ask our panelists questions throughout the session. Please be sure to use that question and answer box in your panel, and our wonderful moderator will be sharing those questions with our panelists throughout the session. This session will be recorded, and we will share that recording with all our attendees and registrants, along with additional resources, readings, links, and information shared by our panelists today. We'll also be sharing ways to stay in touch and continue these conversations about racial equity in farm to school and racial equity-centered evaluation. Before I turn it over to our moderators and panelists, I'd like to welcome you on behalf of the National Farm to School Network. Again, I'm Lacey Stevens, a senior program manager with National Farm to School Network. And the National Farm to School Network is an information, advocacy, and networking hub for communities working to bring local food sourcing and food and agriculture education into school systems and early care and education environments. Our work is guided by our call to action that we released last fall after a multi-year, multi-stakeholder systems mapping process. And that call to action is that by 2025, 100% of communities will hold power in a racially just food system. And we know that we cannot achieve that alone. We know that it is a gargantuan task that we must collaborate and coordinate and work across sectors, across movements, and across partnerships to work towards. And while we develop and learn from these cross-sector and cross-movement partnerships, we also work towards that vision for a racially just food system through farm to school by rethinking the way that kids eat, grow, and learn about food in schools and early care settings. We recognize that this movement towards purposeful, racial, equitable processes and outcomes means shifting all of our work. That means from our internal culture and processes, of course, to how we approach and talk about evaluation in farm to school and farm to ECE. And we come to this humbly and know that we have so much to learn and to unlearn. And we are so grateful for you coming together to learn with us, and so grateful for this incredible group of panelists that we have today. So with that, I would like to introduce you to our moderator for today's session. Please help me in welcoming Dr. Kari Jackson Coatwright. Dr. Coatwright is an associate professor in the Department of Food and Nutrition and is the director of the UGA Childhood Obesity Prevention Laboratory. The overall goal of Dr. Coatwright's work is to reduce the risk of childhood obesity among children aged 0 to 5 years. She emphasizes using health equity strategies to empower communities of color to thrive. Dr. Coatwright previously worked as a research fellow at the CDC Division of Nutrition, Physical Activity, and Obesity, promoting First Lady Michelle Obama's Let's Move Child Care initiative. Her research interests include nutrition intervention, CBPR, and health equity. And her passion is to use arts-based approaches to combat obesity. Dr. Coatwright is the recipient of numerous approach awards, including the 2020 Georgia Academy of Nutrition and Dietetics Distinguished Service by a Researcher Award and the Georgia Trend Magazine 40 Under 40 Award. We are also lucky enough to have Dr. Coatwright on the National Farm to School Advisory Board. So with that, I will turn it over to you, Dr. Coatwright. Thank you so much for being here, and thank you to our panelists.
Hello, everyone. Thank you so much, Lacey, for that wonderful introduction and for centering us. We are so happy to be here today. And as Lacey mentioned, the National Farm to School Network's call to action is that 100% of communities will hold power in a racially just food system by 2025. And I think that's worth repeating because that is a bold call to action. I'm sure you agree. So when I was thinking about this particular webinar that we will be participating in today, I looked up the definition of the word shift. And Webster defines shift as a change in a place, position, or direction of, essentially to move. So I am delighted to be a part of today's movement. Historically, researchers often lack a critical understanding of communities of color. This includes their assets, their resources, and their barriers. Evaluation that does not address the tenets of diversity, equity, and inclusion often leaves little to no room to advance racial equity. Approaching evaluation with a foundation of equity and justice is vital in moving towards racially equitable evaluation. This shift requires an intentional approach to understanding the history of evaluation, the importance of self-reflection in the evaluator role, the need for community-led approaches, and thoughtfulness about what we aim to measure. Today, we will shift the lens of evaluation from its current form to focus on how we can use evaluation to answer questions and measure outcomes that communities deem most valuable, not just evaluators. In my research with Black communities, I often start at the ground level because research questions have not been posed to Black community members. I find this work rewarding, engaging, symbiotic, and empowering. I often say that community engaged work is giving the people what they want. But how do we know what they want if we do not first take the time to listen? Jeremy Everett states that instead of rushing to solutions, we should rush toward understanding. Today's panel features dynamic women who are scholars, leaders, and empowerers. They will share their perspectives, experiences, and expertise on becoming better equipped to partner with communities in racially equitable evaluation. Welcome to Shifting Power Through Racial Equity-Centered Evaluation. I am so excited to get started and to introduce our speakers for this robust conversation. So first we will have Dr. Rajade Berry James. She is the chair of the faculty and professor of public administration in the School of Public and International Affairs at the North Carolina State University. Jade is an elected fellow of the congressionally chartered National Academy of Public Administration. In her book, Why Research Methods Matter, Essential Skills in Decision-Making, Jade explains evidence-based decision-making to evaluate public policies, programs, and practices. She evaluates the North Carolina Farm to Early Care and Education Initiative that successfully connects local farms with local child care centers to empower the development of community-based, equitable food systems. Our next speaker will be Dr. Monique Liston. She is an unapologetic Black woman that identifies as a warrior scholar, joyful militant, evaluator, sister, and friend. As the founder of Ubuntu, she yields her best attempt in this realm to create a safe space for Black women to use their own brilliance to defend their current livelihoods and defend the future livelihoods for Black communities everywhere. She finds her spiritual work in leadership and facilitation. She is a lover, as a daughter, sister, friend, and warrior. Monique cannot wait for the masses to rise up in revolutionary love to propose a new system that rejects the white supremacist, capitalist, militarist, heteropatriarchy, so she can focus on her love of food and feeding people. Yes, as best she knows, she is doing the work that the ancestors set out for her. She is a proud alum of Howard University, as am I, and currently resides in her hometown, Milwaukee, Wisconsin. And our last and final speaker, but not least, is Dr. Jerry Lynn Peak. She is a public health evaluator, applied researcher, facilitator, and coach. She is trained in social demography and reproductive health. She founded 2 GEMS Consulting Services to strengthen programs and support social innovation. Bringing a liberatory lens to culturally responsive and equitable evaluation, also known as CREED, she helps communities to dismantle dominant system harms, build collective power, drive resonant insights, and facilitate individual and collective transformation for the betterment of all. Her insight facilitation approaches promote true understanding, identifying authentically meaningful questions, listening to stakeholders' wisdom and needs, applying diverse customized methods, gathering and mining information with openness and detachment, and presenting findings in accessible forms. Also, trusting in and helping stakeholders invoke their wisdom to continually improve their efforts. Her primary interests are community and societal change, healing racism, youth development, organizational improvement, and engaging community, particularly youth, in learning the action reflection process. Leveraging the Virtues Project as a restorative and affirmative data gathering and meaning making support. Adding to her accomplishments is the fun fact that she is a certified square foot gardening instructor. So we'll have to talk a little bit about that, Dr. P. So thank you so much, everyone, for being here today to share your time and your talents. We thank all of our participants for being here, and we are going to get started. So we are going to get each one of our illustrious speakers to give you a little bit more about their background. You heard about them briefly, but they can give you more insight into their expertise. And we are going to start with Dr. Berry James. Thank you.
Thank you so much for that wonderful introduction to this panel. And it is indeed my pleasure to join the panelists today and others who are interested in this work. I will say that the bio that you shared today about my work is really just that. It's just the work. I have been in the field of higher education for the past 34 years. And during that time, I have evaluated many programs, mostly programs that are serving vulnerable people, whether they be HIV positive people or people who are living with HIV, people who are experiencing homelessness, children who are experiencing cannabis use, adults who are living with addiction and living to overcome addiction, and people who are transitioning into communities from prisons and jails. And so my whole world in those 34 years have always really been about helping people exactly where I find them, and really making sure that I can help to sort of bridge the gap or stand in the gap, narrow the gap, and with the intent, of course, to close the gap between people. I think that, you know, from my own experience with a lot of different programs across the country, I will say that race matters. It still matters. There's a full scholarship on race, right? We know that sometimes outcomes just differ based on race. And so as an evaluator, one who is very much interested in the gap as I see it, I almost always include race as part of my evaluation exercise. It's an exercise in that sometimes it makes people uncomfortable. I have a friend who is a co-author of my own book on why research methods matter, Susan Gooden. She talks about race is a nervous area of government, and she has a book on that particular topic. And it is true that we are still very uncomfortable with talking about race, but even more so, we're uncomfortable when we evaluate programs, when we think about policies, when we examine practices, and we see that outcomes differ by race. And so I think that from an evaluator's point of view, my job is to center race in my evaluation work and look for ways in which I can bridge the gap, stand in the gap, narrow the gap, and one day in my lifetime, I hope to close the gap. And so that's essentially what I do. I think I'm going to stop there now, and then I could continue to talk about some other work, but I think that that's where I want to rest right now, on race.
Thank you so much, Dr. Berry James. And next, we will hear from Dr. Monique Liston.
Good afternoon, I think, everyone. Thank you so much for this introduction, and it is a true honor to be on this panel and just to be counted among the amazing Black women and femmes who are doing this work. I am the founder of Ubuntu Research and Evaluation, and we are based in Milwaukee, Wisconsin, but we have 10 full-time staff, Black women and femmes, who are doing evaluation work. And I share that because it's not about like, oh, I created a business. It's really about the method, model, and space for doing evaluation work. So I came out of the academy tremendously harmed by what it means to have a Black woman's body trying to assert themselves in all different ways. I'm sure everybody else with these titles can testify to that. And coming out of the academy, I was like, I don't think I can make it in higher ed. Like, I'm not going to survive. And I wanted to protect the work that I was doing around dignity-based evaluation, and didn't know what to do. I just felt like so many people chomping at the bit, wanting to make my work theirs. And as a true millennial, I was like, this mine, this my labor. I need to create a space to protect it. And my intention was really just, okay, I could do this for a few years till I figure out what's next. But what I ended up doing is creating a space for Black women to be their best selves in a professional realm. And I share that because the context for evaluating, when we're talking about the potential of merit, worth, and value, in our opinion, requires an Afrofuturist lens. It requires us to have the audacity to imagine Black people in the future. And if we hold that next to whether a program is valuable, worthy, or moving in the right direction, we raise a different set of questions than a lot of non-Black, non-woman, non-queer, non-fat evaluators would bring into the context. I'm trying to imagine a world where I'm well and healthy. And so if your program doesn't contribute to that or the well-being of my family members or children, then it's really not doing what it's supposed to be doing. And so honoring that in terms of this critical question about racial equity and how do we move forward, I think is just putting that in the center of our work, not the side of our work, right? It's bringing it right into the middle. Just to give you an overview, we describe ourselves as a strategic learning organization powered by a collective of unapologetic Black women and femmes working as transdisciplinary scholars, committed to resistance against anti-Blackness and the intellectual and political defense of all Black people through education, facilitation, and evaluation. And so we move this race question right square into the center of our work. And it moves our intentions into a very deep space in terms of just today, for example, a potential client said that the budget that we gave was too broad for them. And they asked, like, can you do something for us on a sliding scale for us? And immediately we responded that said, until Black women's work is fully compensated for in the professional realm, I'm sorry, we can't offer you any discounts. We've held that burden way too long and way too many ways. And I'm seeing, as I have a lot of younger graduate students and evaluators in the organization, feeling very empowered, if we're talking about shifting power, to now really speak truth to power in radical ways as it regards to what does it mean to embody a Black woman or fem's space while being able to be disruptive and really encouraging. And the last thing that I'll say is like really being able to prioritize youth voice in meaningful ways to make sure that that's at the center as a part of Ubuntu's work. Our youngest team member, who is not an intern, is not somebody's here part-time, our full-time employee who gets paid just like everyone else is 21 years old. And I will tell you, this Black femme takes me to task every day. Because if a young person isn't on your payroll able to say, this is not as liberatory as you think it is, you're not doing it right. And they are constantly in a space to say, freedom looks like this, Dr. Liston. So how are you making that dream come true? So that's the space in which we operate our evaluative context. And I'm just so privileged, so honored, and so humbled that I've had Black women and femmes join me on the journey, sort of rejecting what is traditionally known as success, right? And saying like, no, I can do this over here in a way that's affirming and life-changing. So just honored to be here, and just immense gratitude to even be able to hold such a space.
Well, thank you so much for enlightening us about your organization and what you do, both ladies. And we will now move to Dr. Jerry Lynn Peak.
Greetings, everyone. I'm so honored and inspired to be on this panel of Black women proclaiming what it really means to inform our future through measurement and through looking through the lens of our own worldview. So let me tell you a little bit about myself, and I guess I'll do my social location. I'm a baby elder. I just turned 64, so I'm 4 years into baby elderhood. I guess I'll have to just be an elder at 65, one more year to go. And I have professional experience in terms of the work that I do, which is I was trained in public health, and that was a long journey to get there, but it really started, I think, when I learned my survival training for being Black, when I was taught what I was supposed to say, what I could touch, where I could go, how I could look up, look down. And so that really began to shape my understanding of what it means to be Black in America. My evaluation training began, when I think about it, there's an incident when I was young where I said something outrageous, no doubt, and my parents said, "Stop being smart." And I said, "But I thought you wanted me to be smart." And I have one of the mental level IQs, and then I got smacked because it was the 60s and we didn't, people still hit children, and we still do today, but we shouldn't, because it totally perverts their character nonetheless. And I was very confused. And a couple of years later, I remember, oh, smart. There's two things that mean smart. And I feel like that's where I started my evaluation career. And when it comes to social sciences, I actually was in the hard sciences. I wanted to go to med school. I studied biochemistry and dance, and at a all-white women's institution. It was wild. But when I first started social science, it was really being a 6-year-old moving from South Central LA to Mid-City. And we were the second Black family on the block, but within a year, the only 2 white families who were still on the block was an Italian family next door, middle income, lower middle income, with lots of people in their household, and an older couple across the street who died on that block because they couldn't afford to move. And I think those are kind of the things that really centered my interest in equity, my interest in justice. So I was trained as a demographer, and demographers count things. Most of you know about the census. Those are demographers. And we also count behavior. We call that social demographers. About a month ago, I decided I was going to start calling myself and expanding upon the quote unquote field of spiritual demography. And the reason I've done this is that there are certain spiritual principles that, when ignored, allow people to run rampant. And I mean those in the most expansive way in terms of spiritual, such as that we are all one, all humans are one. We know from both physical evidence and from spiritual doctrine that we're one. We know that we all descended from people from the Rift Valley in Eastern Africa. We know that we have DNA linkages to one another throughout the planet. So we know that we have this consistency. Yet we have this false science of race that dominates our landscape. And I'm very proud to be a Black woman. I love being Black. I wish I was darker. I'm one of those Black people. But in the end, as long as we let a false doctrine drive our understanding of ourselves, we're still under the yoke of an extractive, harmful system that uses race as a way to make sure that some people are burdened and others are not. And in some, to the most extreme way, even to death. Yeah. And we're still finding children's bodies in residential school properties. So this isn't just about Black folks. This is about Black and Indigenous and people whose lifestyles and ways of being are said to be less than. So as a spiritual demographer and being a baby elder, I see my role, and also I'm an independent consultant. Two Gems Consulting was named after my babies. I have twin daughters, so they'll be 25 in a month and a half. And a grant came to the end of its run, and my job ended, and I started this consulting firm as a way to stay home with my children, and do that thing. So I have rejected having a traditional firm for 24 years now. And the reason I've done that is that I wanted to work more in collaborative, and I just didn't have the energy to organize. It's another story we can have over like non-alcoholic drinks sometime. But this idea of claiming spiritual demographer is looking at, now I'm an elder, and people always said, old people, they get to say anything they want to. They just get to open their mouth and say what they think. And I think that without locating our actions, whether they be political or they have to do with health and well-being, social, we cannot advance unless we are driven to adhere to fundamental principles that make harming others impossible. Love is at the center of that, and I heard that in Monique's bio, and I think that that's critical. Love is at the center of that, but in order to get to that love, we need to honor justice. But in order to really honor justice, we have to get to truth. In order to listen to truth, I feel like we have to conduct a process of healing. And that process of healing is not just, having a few conversations and trainings and checking some boxes, because the legacy of our experience is bonded to our DNA epigenetically. So our healing has to come in the form of just behaviors, just relationships that allow us to delve into who we are, how we got to be here, what things we need to carry forward, and what things we need to leave behind. And that is radical, because the system that is built upon the false science of race that uses racism as a mechanism for perpetrating certain actions onto people and communities, that needs to be completely upended. And the only way that we can let go of that is to be honest about what it is, what it has done to us, every one of us, white-bodied, Black or brown-bodied. We have to find ways to navigate forward that aren't in the shadow of the systems and behaviors that keep us tied to white dominance, and presume that power is in alignment with white dominance, when all humans have power. We all have power, and we all exert our power all of the time, whether we know it or not, and whether we know we can or not. And I think those things require us to go beyond just seeing and checking the box and running experiments and grabbing metrics. We have to say, if we are truly one, then how does that inform the research questions that I ask? How does that inform the metrics that I put together? If I believe we're different, then how does that inform and shape the way that I construct programs and measure them? So those are some of the things that will probably come out in this discussion today that I can bring to the forefront. And if there's time, I can certainly talk about my sidelines, being a master facilitator in the Virtues Project, and being a certified square foot gardening instructor. So I think I will leave it there so we can get into the discussion.
Well, thank you so much, everyone. Participants, you have met an academician and scholar who meets people where she finds them in Dr. Barry James. You have met a scholar warrior that empowers Black femmes as young as 21 and fought her way, even though she was in higher learning, to another place that she's called to be. And you have met a spiritual demographer, baby elder, that promotes truth and does gardening. How much fun are we going to have today? Okay. So let's get started, ladies. I'm just going to pose this question to everyone. What does shifting power to communities mean to you? And I'll follow up. I'm going to give you a probe. This is 2 questions in one. And how does that call to action resonate with your evaluation work? So first, what does this shifting power in communities mean? And then second, how would you apply that? Or how does it resonate in your own work?
Happy to start. I love this question because it takes me back to being on campus at Howard and sitting with professors in the Africana Studies department who always were giving us the space to wrestle with this question of what is power? Like, what is it? And so I can give so much credence to Dr. Amos Wilson. If you haven't read The Blueprint for Black Power, yes, it's 1,000 pages, and yes, you probably need to read them all. But I think that text and knowing of Dr. Wade Noble's giving us the very simple instruction that power is the ability to define reality and convince other people that it is their own. And those two texts and those two ideas have really situated my ideas of understanding power and why it needs to be shifted. And for me, it's less about thinking about the connection to our day-to-day work. It's less about how do I think about situating power so this can happen. It's more about the moment I engage, I know what kind of power I have. How do I disrupt it from jump, right? And, you know, so many people, my staff at this moment is coalescing around trying to get control of their student debt. Everybody on the staff is like, how do we get control of this? And I have been asked, like, do you ever regret getting your PhD? I regret the costs financially that I've incurred through it for sure. But I realized that it is a license to drive. And if I have a license to drive, it's not for me to get a two-seater and just be cute going down the street. It's for me to say, well, how do I learn how to drive a semi-truck? How do I learn to drive a bus that a whole bunch of people can ride in? And so as soon as an opportunity is offered to me or the space is created for me to engage, the power disruption happens then. Because like Dr. Peak already mentioned, we are living in a white supremacist, anti-Black, anti-femme, anti-queer, anti-woman world right now, right? And our disruption, especially as Black women with these advanced degrees, really is around having the audacity to exist unapologetically. We're already disrupting, and that's a power shift there. And then moving as if that is true, convincing other people that that reality is their own, really creates a new dynamic. Like, no, I'm not following this space. No, I'm not thinking about silencing my voice or curtailing the way I approach things into an air of professionalism, which is all about abiding to white supremacy as I'm supposed to honor that code first. But thinking about the ways that my mere presence disrupts, how can I make sure other people feel as comfortable and have to honor that presence as well? And how do I create space for that? So I think that's the way it goes into the evaluation process from the moment that you engage. And I know a lot of people are put in positions to have to hide their Blackness, their womanness, their feminist, their queerness in order to be professionally successful. And I'm like, no, it's red, black, and green on our website, on the door of our building, everywhere they go. It's like, it's very clear some Black folks in here working. And I feel like that is a part of the power shifting narrative, right? It goes before, it happens before we even walk in the door, before we even sign the contract, before we even put the plan together. It's about creating the space to allow the exist. And then you can go around these processes of helping that shift to occur. But I think holding that question at the forefront of like, how do we even enter the conversation allows it to be meaningful and to get to those shifts more quickly.
Thank you. So defining power in order to understand the shift. Dr. Barry James or Dr. Peak, do you have anything to add to that, even about the part about how this resonates for you in your own evaluation work?
Yeah, so I'd love to center a little bit on the theory of change, right? As an evaluator, it is true that my background is all about measurement and understanding and providing credible evidence for decisions that need to be made, right? So the evaluator or the evaluation really does two things. One thing is it looks at the process, and the other thing is it looks at the outcome. The process is all about sort of, how is it that we've identified the needs and interests of folks who the primary participants for this program or this policy or, the benefits of this practice, right? So how is it that we identify their needs and interests? And then once we identify their needs and interests, what is it that we're actually delivering? Is there implementation fidelity? And can you prove it, right? And how do you prove it given the need to underscore that this is a program that was delivered in the way that it was intended and using the resources that were being provided? So that's the process focus, but the outcome focus is really different and also contributes to the theory of change. The outcome focus is really about, okay, so who were the participants? How many participants participated in the program, right? What is it about this particular program that offers benefit, right? So where is the benefit? Can you identify it? Can you measure it? And does it have meaning for the people and the community that receive this benefit? One of the things about evaluation is all about the credibility of the data that's being collected and used to either justify that this is money well spent, or we missed the mark and need to continue to invest in communities. The other thing is really about the activity. So what the heck was done, right? And did it matter? And can you connect with what was actually done to the outputs, as we call it, when we think about that logic model, right? And so those outputs are really the accomplishments of planned activities, right? So were there some things that were accomplished as we implemented this program, and were they delivered as intended? And so then the focus is on participants, right? Really in a meaningful way, what are the benefits for people? There are a lot of programs that have been funded for a really long time. And I'm not saying that there are benefits that we ought not focus on, but what I'm saying is that maybe we've not done enough. We have, as I mentioned before, a gap that is worthy of examination. And the gap sometimes comes right down according to race, right? So there are access and opportunity being denied in higher education. There is the healthcare gap, which we painfully are living with right now. For decades, we have been examining the healthcare gap, understanding where problems in delivery occur, uplifting voices of people who are not getting the same type of healthcare that other people are getting, right? And what we know is that no matter how we look at this gap, the truth is that the gap is what I call persistent and consistent. But certainly the evidence that we have gathered, the evidence that we are using to describe it, to explore the relationship there, to examine it, right? This is all credible evidence. And so then the focus is really on decision making. So what is it about the impact of the program, particularly that changes an organization, that changes a community, that changes a system because of the program, right? Can we provide credible evidence to underscore the need to focus on whether it be the individual, the system, or the societal impact of the investment of money or new policy, the assessment of a program, the understanding of a best practice or breakthrough approach? And so that is definitely the theory of change, right? So our commitment to, if we invest this, then we do this, then we expect this, then we have this, and then we're able to address this, right? But that theory of change, we don't talk about it enough in evaluation as far as I'm concerned, because what we're really afraid of is that after we take our time and our talent and our investment to help this, right, we find that we fall short. I think COVID is the great revealer. It has taught me the painful reality of race. And I say that not because of the work that we've done in for me, it's been farm to ECE, early care education, but the work that I've done as an equity consultant in other spaces, right? So now we have a situation where all that we've worked on for decades, for me, it's been 3 decades working with vulnerable populations. All that we've done has really been disrupted because of one incident of, a pandemic. But we have other incidents of racism, right? Other negative outcomes for people of color. And so the challenge really is then, what can we do to address the additional questions that we need to answer with respect to outcomes, effectiveness, and impact? And so for me, the work as we think about our intentional effort, right? That's what I describe as the work, is really all about the theory of change, looking at the gap, building a bridge over the gap, standing in the damn gap, right? Understanding why the gap persists, why it's consistent, examining it from all sides so that we can essentially leave this space better than we found it. So for me, it's really about the gap and the theory of change necessary to narrow, or dare I say, close the gap.
Thank you so much, Dr. Barry James. Thank you. And Dr. Peak, I want you to think about that question, still hold that in your mind. What does shifting power in communities mean to you? But I have a specific question to add on. Is that okay?
That's fine.
I see your smile.
Baby over. Test me.
Okay, that's good. I also wanted to add, can you speak to the historical context of how standard or traditional evaluation is complicit in or contributing to systems of oppression? Now, I know we're kind of getting, we're kind of moving now into more specifics, but I thought that you might have something to say about shifting power overall. But this was specifically for you, talking about that historical context, and I feel like it spills into that question. Again, I want to pose that just to make sure everyone hears what I'm saying. I would like for Dr. Peak to speak about the historical context of how standard or traditional evaluation is complicit in or contributing to systems of oppression.
So, all right. So, and let me just point out that unlike my colleagues, I never meant to be a scholar. If the academy is where the wizards are, I'm a hedge witch. I'm out there that's like stirring my potions and what have you. So let me take it from this angle. Everyone evaluates, and everyone does research. Everybody's put their hand on something hot and said, ow, and moved their hand and wondered if they can touch that again. Everybody's gone to the store. Okay, maybe this is more a female femme kind of thing, but everybody's gone to the store to pick up vegetables. And you don't get the apple that's got a big old bruise on it. You leave that one. You take the one that looks like it might be crisp. You take your chances. It might not be, but we try to assess what is going to be the best for me, what's going to last the longest, what's going to be the most nourishing, what's going to be the most helpful. So this is an activity that all of humanity has engaged in since before we became modern humans. We had to have developed that. And anybody who has pets at home or has something to do with animals in any kind of way knows that they have a way of assessing what they need and getting what they need. So I want to jump now. I'm going to jump back and forth a little bit. And I want to jump to the idea of the theory of change and the logic model, because I really love what I'm a first name kind of person, but I'll try to keep that Dr. Barry James, but Jade was talking about in terms of theory of change and standing in the gap. To me, a theory of change, or even a theory of action, where you don't have a real theory, but you're doing something, you have a reason you decided to do it. That's your theory of action. I thought if I did this, something would occur. A logic model takes curated information and ideas about an activity, lays on some indicators that have usually have something to do, indicators and publications and things. That is the currency of the academic career, right? So that's the capitalistic component. I have an indicator set I came up with, and then people can use it for the evidence-based programs. And that's how I make a name for myself. And I may not make tons of money, but I'll get tons of citations and accolades. And, so that's the currency that we're working with here. So most people are tied to a logic model. How can you tell me what you will do to get the indicator that somebody told me was important to get? And the theory of change says, what is it that we intend to do to reach an outcome? One is about faith, and the other one, quite frankly, is about position, right? So I think that when we talk about standard or traditional evaluation, we have to admit that evaluations were designed to hold accountability in certain ways to see whether or not the money invested in something was used properly. So let's roll it back, because a lot of our money comes from philanthropy or comes from government. Philanthropy often helps government figure out what they will fund by testing, piloting some things. And philanthropy funds academia, philanthropy funds community grassroots activities. So we have that going on. So what about this philanthropy? I'm just, Dr. Cartwright, you started it by asking me this question. So people have always been charitable, just like people have always evaluated and done research. We've always been, oh, I got the berries as a hunter-gatherer and you got the badger, and so we're gonna have berries and badger today. Everybody gonna get a little berry, everybody gonna get a little badger. Great. I'm not a good hunter-gatherer. I don't know that these creatures, exist in the same, like that's what people eat. But, I'm gonna catch something, I'm gonna harvest something, I'm gonna dig something, I'm gonna carry water for something, and we're gonna all have some of it, right? So that's charity. It's I feel the virtue we picked today in a meeting I was in, and having charity for yourself, being kind and generous to yourself. That's important too. So in this country, I was shocked to find out about 3 years ago that the philanthropic landscape was predicated upon this country deciding to start federal taxes. And the very rich said, no, not with my dollars. And I'm so petty about this. Okay, maybe that's not the way they said it, but I'm so petty that I'm going to put my money into a trust that I can never touch again. So the federal government cannot decide what to do with my money. And only that money that I decide to keep will be subject to that. And then there's a whole story around how we're going to hide that money and manipulate that money and lobby people to legislate around that money. So I don't have to give up my fair share, because I don't want to. Because I don't want to be beholden to what the government deems good to do with my money. I don't want to. So that's how the big philanthropies in this country started. And then you say, well, but at least it's going to good causes, helping the people. No, the first big cause they went to were like the academic institutions where they were educated, like Yale and Harvard. And and who ran these foundations? The children of the family. It gave them jobs. So who benefited from foundations early on? Privileged institutions and privileged individuals, right? So when you think about the standards or traditions in evaluation, we have to think about, where does our money come from? Our money comes from systems that originated with privileging themselves. But where did that come from? We'll have to take a step backwards in terms of accountability. Well, we are here in this country. I'm sitting with women who identify themselves as Black. We are here in this country either because we had family members who came as immigrants later, I don't know everybody's history, or because we descend from African captives who were brought to this country as part of three paths of slave trades. But this one was the transatlantic slave trade, or the Ma'afa. Really, Ma'afa covers all of that. So we've got to go back to the fact that we were brought to this country in order to allow other people to make money, right? So when we think about where does our money come from and what do we want to evaluate, we want to make money in a capitalist system. We, white men, want to make money in a capitalist system, and we want to do whatever we can to ensure that we can get that money. When we couldn't tame the people in the land that we came to and discovered, when they became sick just because of our presence or because of our biological warfare against them, by spreading disease intentionally so that we could take the land that we wanted, and we then found we didn't have the labor we needed, we found another population to pilfer humans from in order to gain income. Now you guys say, oh gosh, Jerry, now you're going all over the place. My goodness, we're talking about evaluation here. We're talking about accountability and trying to make sure that things are measured. Well, I'm just trying to let you know there's a landscape here. Before we even get to the evaluation that we know, there's a landscape here where, as part of bringing people to this country and exploiting them in the ways that we were during chattel slavery and up until today, there was something else that needed to happen. And the thing that needed to happen is people had to believe that we were not noble. Now we go back to being a spiritual demographer. All humans were created noble, like by birth. Whatever it is, it means to be here. We are here, and we have that nobility of being the creatures on this planet who have this kind of communication where we speak, we create things outside of ourselves, we innovate. It's some serious badassery in the human condition, what we're able to do. So we're all created noble. So in order to exploit people to the extent that you could beat someone to death to make a point, that you could rape someone and say that you had there was no rape that occurred. I don't know if people know about that, but there were laws that said there's no such thing as rape of a Black woman. So that, and I don't mean to belittle this, but you might as well know who I am anyway. That does that mean that we're just like vacuuming penises into our vaginas or something like that? I did sexuality education, that's me. But how does it happen that you're raped and you can't be raped, right? So this is a campaign. It's a marketing campaign. It's a social campaign to ensure that everybody understands that we are not human, to the extent that they had to go with the 3/5 human, which, if you really know the history of that, we were not human at all. But then the South wanted to have leverage against the North, and they said, well, we have all these people who don't count, and we're not getting as much resource as we could from the nation. So let's do this. Let's call them kind of human, and then we can count 3 for every 5 Black people, and that will completely outnumber the North, and we will get more resources. See, that's what it's about. So this behavior of wanting to have resources and using violent and unethical means to get it is what has led us to the conditions that we have today. I could go on, but I want to fast forward. Well, let me just say on the side, just for fun, the richest man to ever have lived on this planet was a king named Mansa Musa from the 14th century, a Black man. Nobody's been richer than him yet. So when people tell you we're not good with money and economics and we can't do things like that, it's not true. Can give you more evidence about that, but it's not the time. When we say that Black people are lazy and shiftless, remind people from Europe went at great expense to their lives. Ships sank in storms. People died to go and get a whole bunch of people from somewhere that they were and bring them here to make them work and build a country. And if you look at like the work of Joy DeGruy, I think I have her little bag there, a girlfriend of mine from high school, she has in her book on post-traumatic slave syndrome that when you look at the evidence of slaves' bones, you can see that where tendons were ripped from the bone. That's how hard we work, the lazy people. So I'm tying together in terms of the history or standards of tradition of evaluation. When we think about social programs that are focused on Black and brown people that we're looking at today, they started from making sure that money was well spent, to measure programs that are targeted towards people who are Black and brown, who have already been in the minds of the populace, meaning ourselves and the white populace, been made to see that we are less than and incapable of caring for, tending for ourselves. That was done to justify the harm and violence that was put against us and was put towards us today. I didn't know I was going to go that way, Dr. Cartwright, but that's what I said, and I feel like I should shut up so we could get to another question.
Well, that was the right way to go. You are teaching, and we appreciate it. And I want everyone to know that I do see your questions in the chat, and we will get to a point to get that. And I'll try to even integrate some of your questions. So thank you so much for that enlightenment, Dr. Pete. We are going to go to you. I'm going to switch it up since Dr. Pete called me. I'm going to say Monique, Dr. Monique. This question is for you. Much of your work centers on dignity. Can you talk about the role of dignity and centering on dignity in evaluation?
Yes, dignity is my favorite thing to talk about. It became something resonant for me when I began to study what was at the core of Black resistance movements over the last 500 years. If you begin to study what our ancestors were writing down, what they were sharing, what reverberated, it was being able to protect their sense of dignity. It wasn't to get whatever equality questions come up, it wasn't to presume the power of those who had power over them. It was really to protect their sense of dignity. And dignity is an idea that we say all the time, but we don't really know what it means, right? We say it with the same sort of energy we use the word love, right? Like, I love Dr. Cartwright's necklace. I love my mama. I love chocolate chip cookies. And it's like, that's not the same. Like, my love for those things are completely different. And I think we use dignity in that same sort of way, right? Like, he was walking in a dignified manner, or look at that sense of dignity. And it's like, that's not really it. Like, we need to start having a better sense of what we mean by sense of dignity. And can we put ourselves in a position to be more conscious of it? And what I usually use to introduce the idea, particularly in evaluation, is to have people think critically about two core concepts. One, breath. Right? Like, everyone participating on this call is breathing, right? And in the era of COVID, I think we've gotten even more sensitive and more conscious about our breath, but it took a pandemic for us to be more routinely centered on our breath, as opposed to thinking about it all the time, because it's a core function of what it means to be alive. And I think what we also should think about is gravity. Right? A force that we're actively engaging every single day, but rarely am I coming up to anybody, Dr. Peak, like, I'm just wondering, how is your struggle with gravity doing today? Like, that's not how we engage folks. But these are things that we are literally dealing with every second of the day. And I feel like dignity is the same thing. It's core to who we are. It's something that we are struggling to either assert, protect, define at every single moment of the day, but we rarely talk about it. And what happens is, if we put that, what we don't talk about, at the center of the conversation versus what everyone is caught up in, this racial question, this gender question, this sexuality question, all these other things, and we begin to have arguments about things that aren't really things, as opposed to our core sense of dignity, right? And it was much easier to bring in questions about race to the resistant white establishment by talking about dignity first, right? And so when we're talking about dignity first evaluation, we're talking about being aware of humans in two specific realms. One, this inherent sense of dignity. I'm a human being, therefore no one can take anything away from me, right? Like, I'm a human being. And if we think about, making the historical connection, I always think about Kwame Ture, Stokely Carmichael, HU grad, speaking when he was the chairman of the Black Panther Party. So right after he left SNCC, right before he went on his organizing trip in the South, he was speaking in Berkeley in 1963. And he said, this Civil Rights Act of 1964, this isn't for me. I don't need a law to tell me I am worthy. White people need a law so they know how to look at me and understand that I'm worthy. And to me, that's like the quintessential role of dignity-based evaluation. The people in the communities that we work with, they don't need anybody to tell them they're worthy. They don't actually need anybody to give them any power. What they need is for the institutions and the powers that be to check themselves. And I think that is the most important offering that dignity-based evaluation. It removes us from looking at the measures that I call thrive despite measures, right? The measures of I'm a success, right? Monique, she got her PhD. She grew up in that poor zip code, and look what she was able to accomplish. And how is my response to surviving an anti-Black world now become the standard for every other Black person in the world, as opposed to the institutions that be should not be allowed to call themselves successful because I've thrived despite the anti-Black world. They actually should be held accountable to what it means to change the world, what it means to undo, dismantle, and remove the harm that white supremacy has created. So when we think about dignity evaluation, it's putting that long overdue honoring of individual sense of dignity at the forefront of the conversation, as opposed to some additional one that we're going to put on the front of the annual report of our nonprofit when we put the picture of the little Black children, right? It's bringing that dignity into a tangible sense of measurement. So we think about that inherent sense, and we think about the social sense, which actually has domains that we look in. We're looking at merit, we're looking at excellence, we're looking at access, we're looking at relationships, and we're looking at identity. And we have measures and frameworks that allow us to think about dignity in those tangible ways, because socially, we're looking for ways for each of us to be affirmed. to know that we are seen. Thinking of the South African concept, sawubona. I see you, right? You want to be able to honor, like, I see you. And it's not just see you as in I notice a body's over there. No, I see you. I see you in all your glory and all your brilliance and all your trauma and all your healing and all your work. And I want to honor that. Welcome to the space. And now let's use that as our criteria for measurement. So dignity is making sure that the institutions that have the most power are also owning that they are responsible for creating the most change. It's not everybody else who is in the community. It's not the marginalized communities that have to prove themselves through their behavior change that they're different. That's not the work that we're doing. So it requires that it's a power shift. But I think in this case, dignity brings a power shift that says it's the people in power that actually owe us the shift. And we need evidence of that to actually think about our movement in evaluation.
Thank you so much. I love the lens of dignity and starting first. And I often tell my students that when we're working to develop interventions, when we speak to communities, look at the assets first. They all have assets. If they weren't, they wouldn't be here. They're all been surviving before we got here. So to really think of it in dignity first, I really agree with that. And I really appreciate your answer to that, Dr. Monique, excuse me. Dr. J, I am coming your way. Now, I want to let you know I was monitoring the Q&A. And so I'm going to ask you this question and just also let you know there's a lot of interest in the theory of change and just how do we have the right metrics? That's what I'm seeing all up and down. What's the process like? You talked about logic models and all those things. But my question is for you to talk specifically about centering racial equity in the evaluation of public policy and how can it inform more equitable policy? So you want me to say it again? Because I know that was a lot.
No, I think I'm okay.
Okay.
These ladies here have me thinking about my being here in this space, right? I will say that my pivot would be as we think about how we apply a racial equity lens, but more importantly, how we center community voices. So I mentioned that I am the evaluator of the North Carolina Farm to Early Care and Education Program. It is a program that has been going on since 2017, funded by the Kellogg Foundation. It is a program that focuses on food for all children, centering race equity in the food system, and really getting child care center directors to get the training they need to ensure that there are nutritional profiles for children in North Carolina. So the theory of change model in that program is much like we've discussed. If we do this, then we do this, then we do this, then we do that, and all children benefit, right? And it looks great on paper. But as the evaluator of this initiative, my job is to honor the voices and choices of community, particularly as I think about how we can examine processes and activities for impact. So the truth is that as a program evaluator, I have a PhD from Rutgers University in public administration. My area of specialization is productive public management. I've been doing evaluation for a really long time. Of course, my evaluation plan and the design looks great, right, on paper. But what I'm focused on in my work is how do I create a meaningful pathway into communities that are not just in the city where I work, which is Raleigh, but all across the state of North Carolina, which has 100 counties. And so a program like this looks really different on paper than it does in practice. So we have, issues of concern and innovations of practice, right? So we bring a program, we deliver a program, we train all program directors and also, others who are connected to the program, the farmer, the cook, lots of different people, but what does it look like in the community, right? And so how is it that I can, given my own perspective, use what I know about the needs and interests of vulnerable communities and also communities of color? How do I create that pathway so that the community voice, the community perspective shows up in my evaluation work? So what it means, quite frankly, is that sometimes you just need to take a road trip. So since 2017, every summer between May and August, I have done exactly that. If we've had 20 programs in the farm to early care education program, the program director and the staff and I have hit the road and traveled all across the 100 counties in North Carolina to see what the program looks like in its context, right? Takes me out of my zone, my comfort zone. It prioritized the pathway into the community. It makes it, for me, it validates that I can see who's involved in the decision making. I can hear the voice to validate program design and program activities. So as an evaluator, I'm looking for a few things. What did the program do? Who benefited? And how can I use this data walk, right, to ground my equity viewpoint? How can I, as a researcher, know what a program is, know how to evaluate a program if I can't see it? And that is the truth. I have to see the program. I have to see the building where the program is delivered. I have to interact with the people who are responsible for delivering the program. I have to see the children who benefit from the program. And I have to be able to provide sort of this identification of, you know, what it is, what it's doing, who the champions are, and who are the cheerleaders. The identifying champions and cheerleaders in the work is more important to me than the things that I count and the things that I measure. Because in a community context, I remember what it was like growing up as a poor child at the Jersey Shore. Right? I know the people who made a difference in my life. And while by all accounts, I wasn't supposed to make it, I made it in spite of all the social circumstances that were stacked up against me. And so it's the cheerleaders and the champions who really helped me understand how we talk the talk and walk the walk. So some of you know that I am a member of the National Academy of Public Administration, but I'm also the vice chair of the Standing Panel on Social Equity and Governance. And all of our work focuses on issues of fairness, justice, and equity in a variety of contexts, including education, policing, welfare, housing, transportation, all of the areas of concern that really benefit human life for people who look like me. So to center these principles of fairness and justice, and really to understand how you disrupt practices and how you dismantle systems that perpetuate racial inequity, is what I feel like my calling is, right? So I'm looking for who are the people in the space, the cheerleaders and the champions, who object to the legacy of slavery, of genocide, of segregation, and of oppression, right? And who are these change agents that really help us understand how to intentionally dismantle structural racism, how to intentionally disrupt the platforms that support racial injustice. I know as an evaluator that my only job is to discern what is the difference, right? When the program is implemented, I'm looking for comparison of outcomes for participant groups. I'm looking for a comparison of outcomes based on my participant groups and external groups, or I'm looking at in-group comparisons to make sure that what I do and the way in which I contribute my time and talent does not contribute to the inequity that I typically find when I go there, right? And so I just know that I could do what I do, right? Which is to make sure that I'm able to discern the impact, understand the difference, and even explore through innovation emerging possibilities. And so I do that on a data walk every summer since 2017. It's hot in North Carolina between May and August. But during that time, this program, all program staff and the evaluator go point to point to point to point to understand what else can we do if food inequity is really the thing that we're trying to disrupt. So I think I'll stop there in the interest of time. You know, obviously we could talk about this all day long, right?
Well, thank you so much. That's so enlightening because in the chat there were some questions about what does the process look like. So I love that you just spoke about this data walk. I love how you framed that. You are actually getting out there in the community, and you have to see. One of my mother's supervisors would always say, inspect what you expect. And that's what I do as a researcher. You've got to get out there and you've got to understand what communities are engaging in to understand the impact and the outcomes of the work. And so, Dr. Peak, I'm going to come around to you, Jerry Lynn, Dr. Jerry Lynn. And I want to ask you, someone asked about when you mentioned earlier that if we believe we are one, how does that affect the design of how we evaluate our programs? So I want to kind of start with that umbrella and follow up with a question that asks you to share more about the importance of individual reflection and transformation of the evaluator. Because what you said earlier in terms of that, how do you view people? Do you view everybody as one? Are we all human? And then getting into that next phase of, well, it's not just the community. It's not just empowering the community, it's empowering yourself. So let's speak about that individual reflection and transformation of the evaluator, please.
Thanks for saving me. I was trying to type the answer to that because I was looking at the time. I was like, should we be answering some of these?
Yes, and you can.
Yeah.
You guys can answer.
So this thinking about if I believe that we are different, that introduces the notion of hierarchy and distinction between groups of people, right? So if we're different, who among us are the better people? And who among us are the lesser people? If we're better people, so here's a harsh example. My mother-in-law just passed away. I love that woman. She was so kind to me. She was part of a family where there were a group of children who were older. Their mother passed away and the father married another woman, and they had a group of children. My mother-in-law told me once that this woman would roast chicken and feed her children with this fresh roast, and she would get that we all been there. You know, you have cold cuts, they've been there too long, they get a little slimy. She would rinse the slime off the cold cuts and serve it to the older children. She didn't think they were the same. Some were her children and some were somebody else's, some other woman's children. And she didn't care about them as much. I can't speak for this woman and say she didn't love them, but the stories I heard did not reflect love. She could discount them because they weren't the same. So even when we start thinking about measures and metrics and interpretations, like the idea that we used to think, and some of us still do, that having no knowledge of a population and no orientation towards what they're about is the best way to be objective when we go into a program. And I'll give you another example about that. I was blessed to go to South Africa. My career was supposed to be in international health, and my advisor, a white woman, said that there are other people who can go overseas and you can work as an Afro-American. This was before African-American, this was before 1988. You have entree into your community. I was like, you think I don't like Black people? Like, that's not punishment to me, but I did want to work overseas. So in the 90s, I got to go to South Africa, so excited to go there. And people were talking about dry sex. Well, sexuality is my thing. And, and if people are horrified, sexuality, it's how I train. Working with adolescents and sexuality, when we're talking about protective behavior, some people said dry humping, that's a protective behavior because you got your clothes on and you're rubbing your bodies and you get a little thrill, but nobody's passing diseases or at risk of pregnancy, right? That was a big narrative at the time. So here I am in South Africa. They started talking about dry sex as a vector for HIV transmission. I'm like, what the heck are they talking about? Like, if you got your clothes on, everything's cool, right? Oh, no. They were talking about using herbs and powders to dry the vagina for more friction for male pleasure. That would rip up the inside of the vagina. I'm sorry if you're triggering anyone, I'm really sorry. Then that's more of a vector for transmission. So if we don't know, if we just presume that, okay, here's the hierarchy and here's what we know from our perspective, and we don't have to ask anybody because, well, they're too ignorant to tell us anyway. They won't even know. So we'll use our own perception to figure out, well, I would be there recruiting, promoting an idea that's actually very harmful because I was confused as to the difference between dry humping and dry sex. You'll never forget now that I've explained it like that. And that's true. Like I sat there going, what are they? Oh, and so if we're not willing to first believe that everyone has this dignity, when I talk about nobility, I mean the same thing that Monique is talking about, right? If we don't believe everybody deserves to thrive and live, then how will we believe that their opinion is worthwhile? And somebody had asked earlier, we were asked earlier about engaging community. You know, if we're going to develop metrics for community, and we're going to create them based on our idea about what's going on, but our idea about what's going on is predicated by not only our own admitted biased opinions that maybe we don't admit, but we know we have them, we just don't want to say it out loud. But that is, I almost said that shit. That is bound to your DNA. That's the trauma that's being carried. The belief that Black people are less than is being carried, for the belief that Indigenous people are unworthy of the land that they were tending quite well before folks arrived here. If you have those beliefs and they're not challenged because we don't have love for one another in that way, we're not going to listen. And we have not listened. Communities that have tended themselves and managed themselves under very harsh conditions, quite well given the conditions. But we look at the conditions compared to white standard conditions, which are not the conditions for all the white bodied people, and say, wow, they're doing such a poor job. That we are still here. I went to New Zealand and I spent one day in Australia on my way I went to Aotearoa, New Zealand, spent one day in Australia overnight going to Papua New Guinea, where I've always wanted to go. I wrote a woman there and I asked her, it was a group of Indigenous Australian people who were in Brisbane area. And I found them on Facebook and I said, hey, is there anybody I can support, any, Indigenous owned businesses? I can go eat dinner, blah, blah. And the woman responded to me like this. She said, I can't think of anyone that I can recommend to you, except that's too far away for you to get there after your flight arrives. She said, we were decimated down to 3%. It's amazing that there's any of us left. Right? So if we don't think of ourselves all as one, many of us are things to be exterminated or to gain funding from. So when it comes to how we conduct our metrics, it will be about justifying treatment that's been done to us. If it's not, then we will do as Davon Love said in his Black paper that needs to go on the reading list, called When Baltimore Awakes, which isn't just about Baltimore, it's about the whole situation. In his executive summary, blew my mind and changed the way I do evaluation. He said, we are pathologized by the systems. And evaluators therefore make measurements that are in alignment with the pathologized idea of us in the system. We don't use the innovations of our scholars and thinkers to solve our problems. So we're reading solutions put upon us by people who don't know us, don't understand the way we work, and have a sickness within themselves, superiority sickness, that they haven't healed. And then he goes on to say, and these systems aren't run by people of color, by Black people, because it's about Black people. And to which I add the codicil, who are not themselves in alignment with superiority sickness and doing the work of white superiority for everyone else, because they have bought into internalized racial oppression and they don't love themselves and don't love the rest of us either in a way that helps us in social service systems. So I know that's still a little theoretical, but once, in the end, if you listen to people and ask them what's the most important thing for them to know, then we can leverage our thinky think skills as social scientists and evaluators, public health people, and researchers, and come up with ways to operationalize those things and measure them so we can see those successes. And if we still think that we can't speak to our own condition, then we'll keep looking to people who are better than us in the hierarchy to determine what we need to know about us to know if we're doing well. And usually that ends up being something that replicates programs so you can keep making money off our bodies. And I ask myself, how is that different from slavery?
Great food for thought. Thank you so much, Dr. Peak. And I know I'm recognizing the time, so I know we'll have to move forward. I do want to ask Dr. List and Dr. Monique one more question. And I do want to let everyone know that we will be sending out resources. We'll get all the feedback. Our panelists are dropping resources in the chat, and we're trying to kind of summarize all of the wonderful questions that we have. And then hopefully our panel will also be able to send some more answers later on. But Dr. Monique, we want to learn more about your concept of beloved communities and how that drives your evaluation work. I think everyone would love to hear about that.
Yes, so I was informed or learned about beloved community as I was studying dignity. For those of you who don't know, this is a concept that was popularized by Dr. Martin Luther King, although it definitely has resonance before then. So I studied about where he learned it from, really thinking deeply about what was his concept and what did it mean. And then Bell Hooks also lifted up the concept and talked about what did it mean. And for us, we look at beloved community as a framework that describes the conditions necessary within an organization, group, or community in order to move forward any sort of equity, justice, or liberation work. So often we put out these calls demanding like this sort of equity move should be done, this sort of thing should be expected from the field, but the organization that's leading the work does not have the capacity to do any of that. Because it's not just a matter of numbers. It's not just a matter of a number of Black faces that we hire or a number of participants in the program. If an organization is not prepared, speaking to what Dr. Peak mentioned earlier, not prepared to endure truth, to endure justice, to engage in healing, they are not ready to hold any racial equity initiative. So we have the beloved community assessment that assesses an organization's capacity to even hold a racial equity frame. And we provide that as an opportunity because so often people are like, okay, we had a strategic planning session and we're gonna help all the Black people in this community do a thing. And y'all can't even be honest about the harm that you created for each other. You've never witnessed anyone in your organization forgive another person. You are scared to speak your truth or to be your full self. Well, if that's true for your organization, there is no way that you can go out in the community and create that circumstance. So for us, beloved community is the step before, right? It's not even the training ground. It's the space to just say, can we hold this? Is it even possible? When we engage organizations around the beloved community assessment, two things usually happen. One, someone leaves. Someone in the organization during that process recognizes, oh no, this is not for me. I'm not ready for this kind of change. I like the status quo as it is, and so I'm out of here. Or somebody leaves because they're like, this organization isn't ready to do any of the things I thought it was ready to do. I gotta move on. And for us, that's the first step. If you haven't created that kind of energy in your organization, then we're not ready, right? And so beloved community has us thinking about our capacity to hold being radically honest, our capacity to being open to liberation. So it's not going to be, we're not going to be ready to hold the beloved community if you're thinking some people don't deserve it. If you think some people don't deserve beloved community, how are you going to champion a racial equity initiative in your sector? And so we assess organizations around that and report back to them. And it's often results that people don't want to hear. And I think that was one of the questions, like, how do you say that? How do you say that? How do you do that? It's very easy to do this work as an evaluator when you have no expectation that anyone's going to continue working with you. It's very easy because then it's easy to tell the truth. And I'll be quite honest, I have lots of return clients because people who are open for it love having the truth being told to them. We love having the truth being told to us, right? And so the beloved community is really thinking about our capacity to do this work, assessing ourselves internally to say, can we even hold these ideas? And being honest that just because we're the organization with the most money, we could also be creating the most harm. And if we're creating the most harm, we probably have no business leading some of the efforts, creating justice, peace, any sort of transformation in our communities. And so that type of honesty is required. And personally, I feel like that's what the evaluator gets to do. let's tell the truth about how we really trivialize organizing and community-based work, how we really are replicating in-stage capitalism by creating fellowships for people to change their communities. No, that's not how any of this radical transformation is going to happen. We actually need to hold ourselves accountable to the truth-telling, the justice, the understanding reconciliation, to being open to our own vulnerabilities and thinking about transformation in that way. So it's a tool and it's a concept, and we hold it at Ubuntu as something that we believe in so deeply. Every other Friday, we spend 2.5 hours checking ourselves against beloved community. So it's not just something that we do for other people. Our staff focus 2.5 hours every other Friday being like, woo, see, this is where I got the beloved community messed up this week. This is where I was challenged by this idea. And we think about that internally and how it works with our clients. So to me, to us, it's fundamental. We can't bypass that in order to move towards this liberatory idea.
Well, that is a wonderful segue into our last, well, we have 4 minutes. I could talk about it all day, like Dr. Jade said. And so just thank you for explaining more about that. We did have a lot of questions that just related to training, to resources, and just how do we do this? And I think everyone has given some wonderful examples, but I encourage all of our participants that had questions in the chat to make sure that you write down the names of our panelists. I'm sure they will be open to receive questions from you further on, because we won't be able to ask all of the questions, but I did try to sandwich some in so that you could get some more insight from our esteemed panelists. So I will ask this one question that really was asking about how do we balance, being true to the community with having measures that are equitable. What's the balance between those two? How do we respond to the community, find a balance? How do we speak up for ourselves without being divisive? And I'll give one of you 1 minute because I'm borrowing time from Lacey. Anybody want to have insight on that?
I want to defer to the elder.
Okay.
Oh, gosh. All right. I think that it's a false dichotomy that, to me, an equitable approach to evaluation allows us to ask those involved to inform us so that we can see, I think Dr. Hazel Simonet talks about a two-way mirror. So we hold this mirror up, see ourselves, we shine a light, so we create a lens that we can look through to know what we're seeing that's based on the orientation from the people. And then we can provide a beacon with like field knowledge, not from the academy, but from other people in the field, so that they can see the bumps that are coming on the road. You can't necessarily avoid them, but you're always better off if you know they're coming. That's my minute.
You know what? This has just been such a pleasure. I'm telling you, I have learned to walk the walk, to tell the truth, and to be a beacon of light. And then what else can we do? If we can't shift and create a change with that, what can we do? So to all of our panelists, we want to say thank you for your time. I know that every one of our participants was just, I don't know, my mind was just exploding. You know how you see that little emoji with the head that's just going, wow. So you have inspired me, and just thank you for the conversation. I'm going to turn it over to Lacey so that she can give everyone a few more details before we part.
I have no words left. This was absolutely incredible, and I cannot thank you all enough for being here and extend my deep, deep gratitude for your truth and sharing these vital truths with us. For everyone in attendance, we will be sharing the recording as well as the resources that folks have mentioned and contact info for our panelists so we can continue this conversation, because this is just one step on a long journey that hopefully we are on together. So please stay connected with us. We have National Farm to School Network has events coming up in October, our movement meeting, which is going to be talking more about shifting power specifically for youth and shifting power in the next generation. And we want to continue these conversations about racial equity centered evaluation as well. So please connect with us so we can have this ongoing dialogue and continue these truths being connected. So thank you all for spending your afternoon with us, and continued gratitude and humility and gratefulness to all of our panelists and our amazing moderator today. Hope everyone is walking away with as much as I am. Thank you all for being here.
Thank you so much, everyone.
Thank you so much. Thank you, Dr. Cartwright.
Thank you.
Oh my gosh, it was amazing.
Wonderful. It was amazing.
Thank you, Dr. Cartwright, and thank you, Lacey, for having us.
Thank you, and
Yes,
thank you, National
definitely.
Founder School Network. This was wonderful. You are walking the walk, as Dr. Peak asked us to do. Be a beacon. That's what you're doing. And I love that you said, there may be bumps in the road, but if you can see them, at least you can slow down and ease up and do something, right? You can prepare
Right.
yourself a little bit better. So I love that. So thank you. Lacey, do you want us to hang back at all?
No, you all are free to
Okay.
go. I'll follow up with you all via email. This was just incredible, and I hope you all have a wonderful evening of rest. I know this is an intense emotional experience, and we're so grateful to have you here.
Well, thank you. Thank you.
Thank
Crystal, I
you.
did not know you
Thank
were
you,
HU.
Crystal.
I didn't know you were the Howard too. The bison of this. We got 3 squares of bison over here, y'all. We just
I should have gone to Howard.
But when you said H, I had to put, that's
yeah, we gotta say